of The Scoop, hosted by Abundant Senior Living Solutions, where we help seniors overcome obstacles proactively. Today with me is Dr. Evan Ratner. Thank you so much for joining us today.
Thank you for having me.
Absolutely. I'm excited about today's topic because we're going to be talking about concussions. Before we kind of get into that, I'd like a little information about Dr. Evan Ratner. He's practiced urgent care and emergency medicine in San Antonio for over 30 years. He's held multiple leadership positions at several hospitals, and he co-founded and practiced as the medical director at Impact Urgent Care. Dr. Evan Ratner is one of the few physicians in South Texas certified in concussion management. He donates his time and expertise to caring for injured athletes and teaching coaches, trainers, and parents about the importance of proper concussion awareness and management. So we're so glad to have you. And I think one of the best things to start this topic out with is, what is a concussion?
So a concussion is a specific kind of head injury, or TBI, sometimes we hear it's called, or traumatic brain injury. And typically it's called a mild TBI, or mild traumatic brain injury. And just like you can have an injury to any part of the body, whether it's a sprained ankle or a broken ankle, you can also get what's called a sprained brain or a concussion. And so it's an interference with how the brain works, but not necessarily a problem with the anatomy of the brain. In other words, it doesn't require surgery to be fixed, but it's still an injury.
So if someone has a fall, like a senior, and they go to the hospital, kind of walk us through those steps of what might they hear.
Okay.
If they've hit their head, obviously. That's why they've been sent to the hospital.
Well, they don't have to just hit their head. In fact, anytime you get a shaking of the head, you can get a concussion. So if someone falls and they fall to their knees, they can still get a concussion because it causes kind of a shaking motion of the head. If you imagine a car accident and someone gets hit from behind and their head snaps back and forth, even though it doesn't hit anything, you can still jiggle the brain and you can still get an injury. So it's important to understand that you don't have to have a direct blow to the head to sustain a concussion. It's a little bit different for our adult population than it is for kids who are playing sports, for athletes who get a concussion, because it is very rare that there's any kind of bleeding or inside the head or problems that require surgery for younger kids. However, for our adult population and our geriatric population, they're on different medications, a lot of which can affect bleeding, such as aspirin or warfarin or Coumadin. And so when someone who's a little bit older goes to the emergency room with a head injury or suspicion of a head injury, they're almost always going to get a CAT scan, while a younger patient almost never gets a CAT scan. Assuming there's no anatomic problems that require a surgeon to relieve the bleeding or fix something that's broken, then they get a concussion, and still they'll usually, about 2/3 of the time, be admitted for observation because the potential for it to turn worse is a lot higher than in the younger population.
So that kind of takes me to the next question. What is the difference between concussions in youth and seniors? Is there a difference?
There's a big difference, and there's a big difference in how it kind of works out. The injury itself is the same, but with concussion, when you think about it, the brain controls everything. So depending on what part of the brain is involved in the accident is what kind of symptoms you're going to be having. And in concussions, you can have symptoms that are more mood-based, like anxiety or depression. You can have some that are more cognitive-based, like confusion or poor memory. You can have some that are more balanced-based, like inability to stay straight. And then there are some also that have to do with how your eyes will track things, and that has to do with how you interact with the world. So in an adult population, a lot of times there's some of that stuff going on already, whether there's a baseline of depression, or they're on medications for other things, or even if there's a history of dementia or diabetes. So they're on medications that can cause some of these symptoms, and they may have some of these symptoms already to start with. So although the injury itself is the same, the baseline from where you're getting the injury and what kind of symptoms you're getting from are oftentimes very different in an adult and a child.
So if someone goes to the emergency room, and say it's a senior, and they do take blood thinning medications and they do a scan and it comes back fine, and they say, you just have a concussion, is that good news or is that bad news?
Well, it's both. A lot of people who go to the ER and they're told they have a concussion have it preceded by the word just. And so what just a concussion means is that you don't need a neurosurgeon. It doesn't mean it's not an injury. And if we're talking about the risk of bleeding in the elderly population, really one CAT scan is very good, but you can have bleeding up to really about 72 hours. So the patient still needs to be watched.
Okay, this is very good information. I think sometimes people hear just a concussion and they take it as a sigh of relief. So if someone is given the diagnosis of just a concussion, what would you recommend be their next steps?
So being treated for concussion, again, is very, very specific because every concussion is different. And so it's really important to, one, recognize that it is a concussion, and when you're being treated, that the treatment is very specific to the injury and to the symptoms that you're having. And also, more so, obviously, in athletic patients and people who are playing sports, you don't want to make things worse. But it's really the same in adults as well, because if they have a fall and they sustain a concussion, until that concussion has resolved, it takes a whole lot less of an injury to make things worse. So while someone is healing from a concussion, it is really important not to sustain additional injury.
I think that that's very important, because I think even as a parent, that's probably one of our greatest fears is we let our children play sports, right? But not, looking at that concussion as we need to make sure that you rest basically until your body's healed. I kind of put it in that bed rest mode, so to speak, when it comes to sports. Like, it's much better to set out a few games than to continue to make that injury worse, right?
Absolutely. And in the professional sports world now, we're seeing where small injuries that athletes used to ignore, or they'd take injections, or they'd play through it, and the old play through the pain is really not such a great idea when we're talking about injuries that are going to take longer to heal, or not heal at all, or in fact end up being bigger problems. And with the brain, one of the huge problems that we feel is very real with concussions is that, one, a lot of people who used to get a lot of concussions probably had one concussion that wasn't healed properly, so their threshold for getting that second injury and the third injury was a lot lower.
Makes sense.
And two, as they get multiple concussions, it's putting them at risk for these long-term problems called CTE, or chronic traumatic encephalopathy, which is what we are seeing in football players and professional athletes, even some soccer players and race car drivers who sustained a lot of injuries to their head over the years.
So that kind of going to throw a curveball your way, because I know we didn't really talk about this, but do you think from the evidence that's there that any of that is leading to Alzheimer's and dementia from multiple concussions? Is there proof of that? Because I hear that topic brought up a lot.
Although we can't point to a specific incident that says, oh, if you get 3 concussions, you're going to end up with dementia, but if you get 2 concussions, you're not. So we don't know the threshold. But I believe that the evidence is really overwhelming that multiple concussions over a long period of time can lead to chronic problems, including things like depression and dementia, and other problems such as Alzheimer's-like syndromes.
Wow, that's pretty powerful. So what type of doctor should a senior go see if they have problems after a concussion?
Well, typically you want to see, and I think this is actually good advice for no matter what you have. If you have a concussion, you want to go to a doctor that takes care of a lot of patients with concussions. If you have a hip problem, you want to go to a doctor that takes care of a lot of hip problems. So there's a lot of subtleties involved in both identifying and managing and coming up with treatment plans for this type of injury. So you want to go to someone who does it a lot. Sometimes it's a sports medicine doctor, sometimes it's an urgent care or emergency physician like myself, sometimes it's a neurologist. But again, you want to make sure that concussions are a big part of their practice.
And one more question that I have for you is is there any medication a senior should not take after a concussion?
Generally, seniors are on a lot more medications than younger people to start with. There's no one particular medication that seniors should avoid. As is the case with all their medications, the more medicines you have, the higher the risk of having interactions. And some of the side effects of medications can sometimes either mask some of the signs of concussion or even look like some of the signs of concussion. So it's important that the medication be included in part of the history and physical examination. But generally speaking, there isn't any one particular medicine that should be stopped for a concussion.
I would like to thank you for joining us today, Dr. Ratner, and thank you all for joining us for this episode of The Scoop.
Come get your scoop at Bee's Knees.
Today's Scoop is sponsored by Bee's Knees in Stone Oak, where today we're enjoying a unicorn's dream. And remember, if you're ever in need for your aging loved ones, our services are free. Call us today. Our number is located at the bottom of the screen.